Let's Chat.
Good morning, I'm Andy Santoro. Chip Chapman and I are so happy you joined us today. Let's get started with our great interviews. I have with me Dr. Mitch Dizon, a very well-renowned doctor at Women's East Erlanger. Thank you so much for coming on the show again.
Yeah, thanks for having me back.
You bet. Talking about your wonderful work with fibroids and all you have done in helping here in the community. Tell us a little bit about yourself.
Yeah, so I'm Chattanooga's only fellowship-trained gynecologic surgeon who subspecializes in specifically minimally invasive gynecologic surgery.
Wow.
So what that means is that I completed a very advanced and rigorous fellowship learning the techniques of laparoscopic and robotic surgery to help treat women with complex gynecologic conditions, including fibroids.
So talk about what that means, minimally invasive, and how fulfilling it might be your work as a doctor and how it can help women.
Yeah, absolutely. It means that I'm able to do these major gynecologic surgeries through smaller incisions. And that means women can get back to their normal everyday lives, their routines, they can get back to work and helping to take care of their family. Overall outcomes are better that way. Maybe
even getting to have a family that they might have been told they couldn't because of a major surgery.
Absolutely.
I bet that's so fulfilling.
It is. It's one of the favorite parts of my job.
I love that. Yeah. So Fibroid Awareness Month, tell me about why we're raising awareness on fibroids.
Yeah, so a lot of women actually have fibroids. So fibroids can occur in about 80% of women. Fibroids can significantly impact women with regards to their menstrual cycles. So they can cause heavy bleeding, prolonged bleeding where women can be anemic or have low blood levels. As we mentioned earlier, they can also impact fertility, so the ability for women to have children. They can also cause pelvic pain, pelvic pressure, painful periods, and just significantly impact a woman's life. So
everything you said, a woman might say, hey, I have that, but how do you know if what they're experiencing, or what should they do if they're afraid what they're experiencing is a true fibroid situation? Yeah, so the first thing they should do is obviously tell their healthcare provider. So whether it's their primary care doctor or their OBGYN, let them know that they are experiencing these symptoms. So don't just ignore it. Don't ignore it. And you said 80% of women have fibroids? Yes. What are they? Like, and what causes them? Yeah, so fibroids are actually, thankfully they are benign, so non-cancerous growths that can occur in the uterus or in the pelvic organ. Sometimes we can see fibroids actually in ovaries. Okay. But they can range in size from small peas to even like basketballs. Now, what's interesting is food and lifestyle changes can impact fibroids. That might be something that can be prevented? Yeah, so they can actually help with some of the symptoms of fibroids. So eating a healthy diet, managing your stress can help to decrease some of the symptoms of fibroids. So would managing stress and eating a healthy diet impact period pain in general, or is it only fibroid related? Absolutely, it can definitely help with period pain. That's so interesting. Yeah. There's so much I want to ask you, about being a woman and the things I experienced. But talk to me about treatment options. You said prevention, managing stress, which is interesting. Yeah. Because I'm curious how that impacts fibroid stress. Sure. Yeah. Can you tell me about that? Just stress in general can decrease like the amount of, or stress in general can increase the amount of inflammation that a woman may be experiencing in their body. So that's a fascinating correlation. Yeah. So talk to me about treatment options. Yeah, absolutely. Absolutely. There are so many treatment options that range from medical management of fibroids that usually help to regulate the amount of hormone levels in the body to the types of surgeries that I can perform, whether it's burning the actual fibroids themselves to help them shrink, or removing the fibroids and leaving the uterus in place, to definitive management, which would be actually just removing the entire uterus. So before services like yours were offered, what were women facing in Chattanooga or in smaller towns in terms of fibroid treatment? Yeah, so I was actually the first person in this region to offer the radiofrequency ablation procedure, so being able to burn the fibroid and let it shrink. And then we now have these advanced techniques where we can
perform these very complex surgeries through smaller incisions that lead to faster recovery.
It's truly a miracle what you offer, Dr. Dizon.
Yeah, happy to help.
Yeah, I'm excited to have you on the show again and talk about the wonderful work you're doing. How can we schedule an appointment or have our primary care doctor schedule something?
Yeah, absolutely. So I see patients at Erlanger East, Building A, Suite 301. You can reach our office at 423-778-6447 or 778-MIGS, M-I-G-S.
Perfect, perfect guest. Have all that memorized for me. Thank you, and thanks again for coming on the show. Give him a call, 423-778-6447, to talk about the options for you if you think you're suffering from fibroids, and a really wonderful treatment option. Thank you again.
Thanks for having me.